Have you ever stopped to think about what it really takes to get blood from a donor's arm to a patient who desperately needs it? It's this incredibly high-stakes journey packed with precise science and so many critical safety checks. So that's exactly what we're doing today. We're going to follow a single pint of blood, step by step, to demystify the amazing process of a blood transfusion. And just to give you a sense of the sheer scale we're talking about, look at this number: 85 million. That's roughly how many units of blood are transfused across the globe every single year. It's one of the most common and absolutely one of the most life-critical procedures in all of medicine. So, what is going on in that crucial gap between the moment of donation and the moment of transfusion? Well, let's break it all down. We're going to follow the story of one single pint of blood on its mission to save a life. Okay, so here's our roadmap. Our journey has 5 main stages. We'll start with the donation itself. Then we'll go inside the blood bank. After that, we'll dive into the science of making a perfect match, watch the actual transfusion procedure, and finally we'll look at the risks and what recovery looks like. All right, so first things first. It all kicks off with a simple but truly profound act of generosity. The donation is the first and, you could argue, the most important step in this whole story. You know, for the person actually donating, the whole process is designed to be super straightforward and safe. It starts with some quick registration and a confidential health screening. The donation itself, that only takes about 8 to 10 minutes. And after that, you get a short rest with some snacks and drinks to get your fluids back up. Pretty simple, right? Okay, so once that bag of blood is filled and leaves the donor's side, its journey is really just getting started. It now enters the controlled world of the blood bank, a place of really meticulous science. And here's something you might not know. We almost never transfuse whole blood these days. Instead, that donated pint gets put into a centrifuge, spun down at high speed, and separated into multiple life-saving products. So one single donation can actually end up helping several different patients. And that spin breaks it down into these 3 key players. You've got your red blood cells, think of them as the body's oxygen delivery service. Then there's plasma, that's the liquid part, and it's full of vital proteins and factors that help your blood clot. And finally, you have platelets, tiny little cells that are absolutely essential for stopping bleeding. But hold on, before any of this can be used, we have to talk about safety. This is absolutely critical. Every single unit goes through a whole battery of tests for infections that could be passed through transfusion. This screening, which is recommended by the World Health Organization, is what makes our modern blood supply so incredibly safe. So, the blood has been processed, it's been cleared as safe, and now we get to the scientific heart of our story, finding that perfect match between the donated blood and the patient who needs it. This part is fascinating. To really get this, we have to talk about something called antigens. The easiest way to think of them is like little ID badges on the surface of your red blood cells. Your immune system is trained to recognize your own body's badges, and if it sees a cell with a foreign, unfamiliar one, it's programmed to attack. That's the entire biological basis for blood types. And this chart, this is basically the rulebook for blood transfusions. It's all based on the 2 most important antigen systems, the A and B antigens and the Rh factor, which is what makes a blood type positive or negative. And you absolutely cannot break these rules. Getting this wrong can trigger a massive and potentially fatal immune response. Now, within this whole system, there are 2 VIPs, 2 very special blood types. O negative is called the universal donor. Why? Because its red blood cells don't have any of the major A, B, or Rh antigens. They're basically invisible to other immune systems. And on the flip side, you have AB positive, the universal recipient, because their immune system recognizes all the major antigens as friendly. But wait, there's more. Even after all that typing, there is one last physical safety check called cross-matching. A lab technician literally takes a small sample of the donor's red cells and mixes it with the patient's plasma. They watch to see if there's any clumping. That's called agglutination. If they see any, that blood unit is rejected on the spot. It's the ultimate confirmation before the blood ever leaves the lab. All right, we're leaving the lab. The blood has passed every test. It's a perfect match, and it's time for the final leg of its journey, the transfusion itself. We're moving to the patient's bedside. So a normal red blood cell transfusion isn't a race. It's a slow and steady process that usually takes somewhere between 1 and 4 hours. The rate is really carefully controlled. But the most critical part of this whole timeline, it happens right at the very beginning. 15 minutes. That's it. This is the most important window of the entire procedure. A nurse will stay right there with the patient for this whole time, monitoring them super closely. Because if a severe reaction is going to happen, it's almost always going to happen right then and there. So, what are they looking for? What are those red flags? Well, these are the classic signs of what's called an acute transfusion reaction. Things like a sudden fever, getting the chills, any weird pain in your back or chest, or having trouble breathing. Any one of those symptoms, and the transfusion is stopped immediately. And just like that, our pint of blood has made it. Its journey is complete. For the patient, this is where recovery starts. But, just like with any medical procedure, we also have to talk about the potential risks. Now, because of all that crazy, meticulous screening and matching we just talked about, serious reactions are super rare. And while they can happen, most of them are pretty mild, like a slight fever. The really serious complications, like a lung injury or circulatory overload, are very uncommon, but they're precisely what all that careful monitoring is designed to catch and prevent. But look, for the vast, vast majority of people, the result is just overwhelmingly positive. As soon as those new red blood cells hit the bloodstream, the body's oxygen-carrying capacity gets an instant boost. It's not uncommon for patients to say they feel better almost right away. This entire incredible journey we just followed hinges on one thing: volunteer donors. And keeping up with demand is a constant challenge for blood banks everywhere. And that brings up a really big question for the future of medicine. What's next? Well, the answer might be something called artificial oxygen carriers. Basically, these are lab-made solutions designed to do the number one job of red blood cells: deliver oxygen. While they're still being perfected, these blood substitutes could one day totally revolutionize emergency medicine, bypassing the need for donors and this whole complex journey entirely. It's a really exciting look at what's just over the horizon.